Hi, my name is Landon Sims, and this is the Kinesiology 220 video for how to properly treat and bandage a wound. Before touching a patient or victim, you first need to be sure to properly clean your hands. Using warm soap and water, you're going to want to wash your hands for 15 to 20 seconds, covering all the areas in between fingers, around the wrists, under the nails, and anywhere else that germs may appear. After washing your hands, you're next going to want to apply your exam gloves. And whenever dealing with a patient at an emergency scene, you want to make sure you have proper infection prevention supplies, such as mouth-to-barrier devices, eye protection, or gowns. In this case, we'll only need exam gloves. Now it's time to assess the victim. First, we're going to get a just general impression of what the situation seems to be. Here we have what seems to be a bloody small cut or scrape. We're also going to next check for responsiveness. The patient is responsive, alert, no screaming, pain. Then we're going to see for breathing. Is there normal breathing with the patient? Our patient has a normal breathing pace. And then we check for severe bleeding. This is a small cut. There's a little bit of blood around the side of the wound, but not much bleeding. So no severe attention is needed. And then lastly, if there's a certain position that we want to put the victim in, we position them into that position so they can receive further medical attention. Next, you're going to examine the wound for gross contamination, dead tissue, or any foreign objects that are protruding or sticking out of the wound. This looks like just a regular bleeding flesh wound. So what we're going to do is we're going to cleanse the periphery of the wound with a either soapy water or sterile water solution, whatever's available. This can be accomplished by using sterile gauze pads as to prevent infection. Upon further examination of the patient, we see that we have a superficial laceration, so no sutures or stitches are required. This is important though to note because contaminated wounds, bites, and punctures need to be left open. Suturing before sterilizing a wound can sometimes cause infection. The next step is going to apply a base antibiotic to the patient's wound. Take a common antibiotic such as Neosporin or Polysporin, apply a thin amount to a Q-tip or other sterile application device, and then spread across the abrasion surface. Take caution, as some antibiotic ointments can cause rash or irritation in some people, so be sure and ask about allergen information with your patient. The last step is going to be to cover the wound with a dry bandage. It's important to change dry bandage dressings at least once a day, or whenever a bandage gets wet or dirty, so whichever comes first. So we're just going to take the patient's small laceration and begin winding sterile gauze around the wrist. Then, with a simple cut and the application with sterile tape, we can seal the bandage shut. Finally, for follow-up patient care after the wound has been properly bandaged, you're going to want to inform the patient of a handful of things. The patient needs to be watching for signs of infection in subsequent days, possibly weeks after the wound has been inflicted. There can be green or yellow discharge. That's a sign of infection. Additionally, the patient could have fever. That would be another sign of infection. And lastly, if the cut or abrasion is deep enough, you want to ask your patient if they've had a tetanus shot recently, and if not, they may wish to consider to do so. After attending to the victim's wound, you're going to want to properly dispose of your gloves again. Pinching at the cuff of your first gloved hand, peel out until the fingertips, and remove. Then using your fingers from your ungloved hand, go underneath the cuff of the other, and remove until both gloves are inside out and ready to be disposed of in a proper disposal container for gloves.